She is the former Executive Director of the West Virginia Alzheimer's Association, a certified dementia practitioner, and a speaker and trainer on the topic. She is also a caregiver to her 88-year-old mother who has Parkinson's disease and Alzheimer's. I'm pleased to welcome Jane Marks. Jane, thank you for being here.
I'm pleased to be here. Thank you for having me.
Can you tell us a little bit about your caregiving experience? I think it's important as we talk about this to set the stage for why you're here today.
Sure. Well, as you said, I was the former executive director of the Alzheimer's Association, running a statewide nonprofit, which kept me pretty busy. And we were noticing some changes in my mother, and then the changes expanded and got a little more involved. And then she was diagnosed with Parkinson's as well as early stage Alzheimer's disease. We were able to manage it for a while with private caregivers going into the home, but none of her children lived there. You know, I was an hour away, but none of her kids lived right there with her. And after time, that became a little more challenging, even though it wasn't a far distance. It's not like being right down the road. And then she fell and broke her hip. And 5 days after getting out of the hospital from that surgery and recuperation, she broke it again.
Oh, no.
So we ended up bringing her to live here in Charleston in an assisted living where I was 10 minutes away. But as time went on, her care took up more and more of my time, and I was ignoring, you know, my poor husband, and I probably wasn't doing as good a job as I could have done at work. So I finally made the really tough decision that it was time for me to retire, at least from my job at the Alzheimer's Association, so that I could be a little more flexible and give her the attention and care that she really needed.
You know, I think there are many people that are in the same situation that you're in. I mean, I know personally, I dealt with that with my mother, and you know, how do you balance the time that you have and the time that you need with what your family member needs? And you know, we become the caregiver, and it's an important job.
It's an extraordinarily important job, and it can be all-consuming. You know, I'm blessed in that, again, my mother doesn't live with me. You know, it takes up a lot of time. I was on the phone with the facility last night at 9:30, and I was there again at 9 o'clock this morning because there was a particular issue that we were having problems with. But, you know, some caregivers are there 24 hours a day, 7 days a week.
And I know you have sort of a unique philosophy about caregiving. Can you share that a little bit with our viewers?
Sure. My philosophy is twofold. Number one, you know, years ago when I began working with caregivers, I heard that phrase, sandwich generation, that was coined by a social worker back in the 80s. And of course, she meant that generation of people who might be caring for aging parents, but still have children that they were caring for. But what I realized is that it doesn't matter if you're the 19-year-old granddaughter doing the care or if you're the 86-year-old spouse. It's not about a generation. It's about you as a caregiver who find yourself sandwiched, stuck between, kind of wedged between your own needs and hobbies and friends and health care and maybe your career, and then the well-being of that person for whom you care. And my second philosophy, and we were kind of talking about that before we started filming, is that it's kind of like climbing Mount Kilimanjaro. I have a friend who actually climbed Mount Kilimanjaro, and you know, you can read about it and you can train for it and you can watch videos, talk to other people, but when you're on that mountain, it becomes a whole different experience. And it's not only a physical challenge, but it's an emotional and psychological challenge. And so I feel like we caregivers are climbing Mount Kilimanjaro every day.
And I know that you feel strongly, and I agree as a healthcare provider, that we have to support people who are caregivers too. If we don't support those individuals, they're not going to be able to care for their loved ones. And there's a great initiative, I Heart Caregiver. Can you tell us a little bit about that? Because I really think it's critical for people to learn how they can have a support group and help themselves.
Absolutely. Well, as soon as I retired, that organization called AARP grabbed me. We had worked together, excuse me, a lot, but now I'm able to be a volunteer for them. I have my AARP volunteer badge. And last year, AARP nationally started an initiative called I Heart Caregivers because they wanted to recognize the dedication and the many hard hours of work that family caregivers provide. So they started this initiative. They have a fabulous website now with lots of good information for caregivers. So if you can't get out and be with other people to ask questions, you can get on their website. They also have pushed through lots of initiatives about caregiving. The most important was here in West Virginia, the CARE Act last year, which stands for Caregivers Advised record, and enable. I have to stop and think about that because I just call it the CARE Act. And that has been extraordinarily helpful. And of course, you coming from the hospital setting will understand this. Having a loved one in the hospital can be a challenge. Even though they're getting good care, it's a challenge.
Absolutely.
So what the CARE Act now has done is that patient in the hospital can designate a caregiver. And it can, of course, be their brother George or their sister or their child or their spouse. But that caregiver's name goes on the chart. It's recorded. And everyone else now knows that that caregiver is to have information about the patient, their condition, and their discharge. And that's another important piece is now that caregiver will be notified when the patient is going to be discharged, you know, because sometimes they'll just say to the patient, you're getting out this afternoon, and nobody else knows. And the other thing that it requires now is that those caregivers will be given in-person, hands-on instruction on the care for that individual once they get home. Because, you know, sometimes now caregivers don't just have to give them chicken soup and fluff their pillows when they get out of the hospital. Sometimes caregivers have to provide some hands-on care, cleaning wounds and those sorts of things. So no longer can the hospital just hand you a piece of paper that has the instructions. Someone actually has to personally demonstrate and talk to that caregiver and the patient about the kinds of care they're going to need once they get home. So I think it's really helpful.
You know, I felt strongly about that when I read that piece of legislation, very supportive of it, because, you know, we at DHHR do a lot of services for seniors out there, and we find that sometimes when we go into homes that really caregivers don't know. They want to help, they want to do, but they have not been educated on how it is they can care for a loved one, especially one that's been in the hospital and been very sick. And so, and it also is important, I think, as you point out, that it may not be the daughter that lives in another state, but it may be the neighbor who is the primary caregiver. And in the healthcare world, we have tended to think it's the family we have to educate, but in some cases, I think you would agree with me, it's not a family member. It may just be someone that's close that does caregiving for that individual, whether it's, you know, on a volunteer basis or because they're a member of their church.
Certainly, because, you know, families have changed. You know, one of my favorite TV shows is The Waltons, but we're not like The Waltons anymore. Our children aren't still living at home, and grandma and grandpa and mama and daddy are right, they are close by. We're scattered. And so certainly you're right. You know, AARP has discovered that there are about 300,000 unpaid caregivers here in West Virginia that are providing care for, as you said, either a family member, loved one, or it could be a neighbor or someone in their church that they care for. And they provide care that, if we had to pay for it, is worth $2.8 billion. That's a B. That's not the million. That's a billion. So certainly we should support those people, because for heaven's sakes, if we had to pay for those people to be cared for, so we certainly should do everything we can to support those caregivers and help them do their job.
I agree. And, you know, the good thing, I think, is that the culture in West Virginia is one of support. You know, we are family-oriented and extended family-oriented. We bring people in and we care about them, and I think that in turn helps us culturally, generation after generation, to help people that are in the senior population. But we can't do enough. You're right. We have to continue to support them and help them, because we know we have an aging population.
We sure do. Unfortunately, Karen, you and I are going to be there someday,
Yeah,
sooner than we want to think about. But no, you're right. It's a particular issue for West Virginia, and I'm just thrilled that we can all collaborate and work together. Groups like AARP, state agencies like the Bureau and like DHHR can work together to help these individuals.
I truly believe it's public-private partnerships, and all of us really having the same goal in mind, which is taking care of our seniors and making sure that they are able to live independently as long as possible, and that we're doing everything to make that happen. And so I thank you for the work you do, Jane, with AARP and other organizations, and I think all the volunteers out there and the people who are caregivers. It's very important work. So thank you for being on the show.
Thank you. You're very welcome.
That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the Department of Health and Human Resources. Thank you for watching The State of Health here on the Library Television Network.